Corewell Health recently acquired new technology that will help treat certain cancers of the liver. Doctors tell me they have treated their first patient, and he is showing promising results with the tumor being essentially eliminated. Here today to tell us about this new technology and treatment option is Dr. James Morrison, a radiologist at Corewell Health.
Thanks for having me.
Thank you for being here with us. So first, just tell me about this new technology.
So this is a technology for treating cancer that is completely non-invasive, and unlike other non-invasive technologies, it doesn't damage any of the surrounding tissue. So we can be very focused on the cancer itself and preserve as much of the normal tissue around it as possible.
How does it work exactly? Essentially kind of melts the tumor away, is that correct?
Liquefies would be a good way to say it.
Okay.
So it focuses a beam of ultrasound energy, and where that beam comes together, there's a point in space where there's a microscopic bubble cloud that essentially destroys tumor tissue. But you can stick your hand through the beam, and as long as you're not at that one point in space, it's not going to damage any of the normal tissue.
Wow. So what specific chronic conditions will this technology be used for?
So this is specifically focused on cancer, and so for those folks that have cancer that either originates in the liver or is cancer that has spread to the liver from other sources, those are the places that we can treat right now. But the technology can be used elsewhere in the body. It's only FDA approved at this point for liver, but the next will be the kidney, and then beyond that, things like pancreatic cancer and other places in the body as well.
Minimally invasive procedure as well, and that patient can leave that same day, is that correct?
Same day treatment.
Okay.
Our first few patients, we're going to be extra precautious and keep them in for observation, but in the future they'll go home the same day. It's well tolerated. We're one of the first 30 or so hospitals in the country to be able to offer this technology.
Okay, and you have treated your first patient.
That's right, yes, last month.
Okay, and how did that go?
Everything went smoothly, in fact, even more smoothly than expected. So very satisfied, very happy with the treatment. It was a successful treatment in that the tumor was completely ablated.
I think we have some images that we can pull those up in just a minute. Maybe you can talk about that, what it looked like before and then after. There we go.
Yeah, so the image is on the left-hand side there. There's even an arrow, I think, that's pointing out where the tumor tissue was. And then you can see on the right-hand side that area that is a little bit darker now. That's the treatment zone, both including the tumor and a little bit of the tissue around it. And as time goes by, that tumor tissue is going to just melt away, as you said, and the normal tissue will fill in that area.
So how will this change his overall quality in life in the years to come?
So in this case, this was a tumor that had originated in the liver, and he's at risk for developing additional tumors. So by preserving as much normal tissue as possible, we're allowing him to have additional treatments in the future if necessary. The less invasive nature of this is better than going in like a surgeon and cutting out large pieces of tissue, or using other technologies which may burn or destroy normal tissue around where the tumor was.
Doc, what was it like for you using this new technology?
It's always exciting to be able to use something that's brand new. I think that there's a lot of potential for this, like I said, to use elsewhere in the body. So to be one of the first places in the country to have something like this is very exciting, to offer that treatment to our patients and the patients throughout West Michigan.
Yeah. Anything else that you wanted to share that I didn't mention?
No, I think we covered it. It's, like I said, very exciting. We hope to be able to continue to treat more patients as we get used to using the technology, and even bring in patients that might not have had an option for treatment in the past. Yeah,
so someone just come in to the doctor and talk about that if they're a candidate for that technology, for that treatment.
That's right. Yep.
Okay, cool. Well, thank you so much for coming on. We appreciate it, doctor.
Thanks for having me.
Okay.